Michelle Morris MBE, Pathway Lead for Early Years Language and Communication for the Greater Manchester Combined Authority, spoke to a via Zoom meeting on the 23rd of April 2024. Michelle was a consultant speech and language therapist within the NHS for many years. She started the Salford Language and Communication Pathway, which by 2016 had become the Manchester and Salford Language and Communication Pathway. Then in 2018, she was invited to lead the pathway across the 10 city localities of Greater Manchester. She supports health and early years practitioners from each of the localities in the interprofessional programme.
My name is Michelle Morris. For many, many years, I was a consultant speech and language therapist working in the NHS. And in that capacity, I started the language and communication pathway that was originally the pathway for one particular locality in Greater Manchester, Salford. 2018, I was asked to lead this across Greater Manchester, and that's what I've done since. So it's been a while in its development, and each year we try and iterate and make it a kind of more mature pathway. So my background, as I said, is speech and language therapy, and I have an unusual background in that I also have qualifications in public health. And so I look at language and communication needs not from an individual perspective, but from a population health perspective. And that population health can be either a school or setting, or it can be a community, or it can be a city locality, as we call them in Greater Manchester. I lead on this pathway in terms of its strategic positioning and development. And I support locality leads from each of the 10 localities. We have a health and an early years practitioner lead, so that we have that kind of multi-professional dimension to the approach. So I particularly like this slide. It's a relatively recent one, as you can see from the date, 2023, but I think this really sums up the approach that we take in Greater Manchester to early language and communication. And this slide describes what's called a bioecological slide. And a bioecological approach is one that looks at the kind of biological factors of a child and in relation to their language and communication, but it then really considers those factors in relation to their ecology, i.e. where they sit in terms of their society, in terms of their support setting, their family, etc., etc. And that's really kind of the approach that we take in terms of moving away from that medical model of delivery and thinking about how we can influence and support language and communication in that very much wider context, and thinking about how we can influence and support language and communication in that very much wider context. Okay?
Very good. Thank you very much. Next slide, all right?
Next slide, yeah.
It's a lovely slide, actually. I congratulate you. It's great.
I'd like to think it was my slide, but it isn't. I'm not so clever as to develop that, but it really kind of sits well with oh, can you just do all the clicking, because it's I forgot this slide is one where things zoom in, which is really quite annoying.
What do you want me to do? Click, click, click.
Yeah, click, 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 because there's loads of things that will appear. That's it. Just click them all up, and I'll start talking to it.
Right. Wow. Hang on, let's get this again. Move ourselves out of the way. Wonderful. Okay.
Yeah. So this is the Greater Manchester Early Language and Communication Pathway, and there's absolutely nothing rocket sciencey about it. It's really very straightforward. And I should say that actually we're in the process at the moment of completely reviewing the pathway, because we've got so much learning now. So whilst this is our current pathway, hopefully in in 3 to 6 months' time, our pathway will look slightly different to this. But the fundamentals will be the same, in that we look for identification, we look for how children are considered, how the language of and communication of children is considered, and then we look at different ways that we can potentially offer intervention as a whole system approach to any needs that are identified. So I'm not going to talk through the model in a great amount of detail, other than to say that like most models that identify language and communication, there is a touch point at 2 years. But what we have learned in our Greater Manchester work is that actually that's too late. And the reason we think it's too late is because actually the touch point doesn't actually ever come at 2 years. And with the issues in relation to, particularly in relation to the health visiting workforce, that contact point is likely to be later, which means that if children are not identified by the time they're 2-6, 2-10, then they're already, that gap for opportunity, that opportunity gap for intervention is reduced. So we have been doing some testing in GM, looking at if it's possible, if it's feasible, and if it's economical to do a testing at 18 months. And we're building a business case at the moment, which is identifying that actually in the localities where this has been tested, it's been really, really well received. We've identified children earlier, and we've been able to put in place interventions that support language and communication development so much earlier, before children get to the point where they are about to start entering into the education system. So just to say that actually in GM, we use our tool of choice for identification is Welcome. We have used that long before ELIM came about. And we took a strategic view in GM that we weren't going to switch to ELIM, primarily because we have opportunities for A, for earlier contact, but B, most importantly, that with training, lots of other different professionals, individuals can use that tool and identify language and communication issues. And that means then it takes some of the pressure off the health visiting service, because actually for many places that's a bottleneck. And given that they are in many areas looking to target that assessment, we can offer a more comprehensive assessment by allowing other practitioners with training to deliver both the assessment and the intervention. And we've done a shed load of work in Greater Manchester on what needs to happen as part of that training for practitioners. And we work with other localities, other areas. So we work collaboratively with York, who are doing something in Yorkshire, and we kind of share our learning, so that we're trying to accelerate the process really of implementation as fast as we can. And we share our learning with York, and they share their learning with us. So that's been a very helpful collaboration. And what we know is that if you don't give practitioners tools, but ask them to do the training first, that you get better outcomes. Because actually and to use the Welcome tool itself, you can just basically hand over a pack and say, go away and do this. And we know that doesn't produce good outcomes. Staff don't know how to use it. And even with quite sophisticated training around that, what we've realized is staff are not confident in using the Welcome tool, particularly for the interventions. So we've developed what we call a gold standard intervention, and we're just about to start rolling that out. But that's all come about because we've done collaborative work with our academic colleagues in Manchester Metropolitan University, who have done independent evaluation. So we kind of look at this as a whole system and think about everybody who's involved with the implementation of this pathway. I've already talked about early identification and intervention. The central role of families and the importance of the home learning environment can't be underestimated. And again, we've got a whole load of learning now about actually what works with families, what works for families, what works with families. And we are doing a lot of thinking about identifying and supporting families who have views that mean that often they don't understand or see their role in child development. So we're kind of really trying to target groups of families. We've done lots of work on supporting multilingual learners. We link with other pathways. So we link up with the parent-infant mental health pathway. And we try to raise awareness of the importance of speech, language and communication needs by all our citizens, irrespective of whether they're parents or practitioners, but just kind of making language and communication a really known thing in Greater Manchester. So I talked I've already talked about workforce development and
Yep.
how central that is to our work, and we spend a lot of time supporting workforce to understand the need for language and communication support. So for example, we've developed a package for baby rooms in nurseries, because we having talked to staff, we recognized that actually that was one of the areas where staff felt less confident in interacting with children. So we have a whole package of development, a 6-week package for staff, and we have some lovely outcomes from that work. The pathway development is an iterative process, and what we have is every 2 years we carry out a stock take. So we ask each locality to get all its workers together, all its leads, and to actually evaluate where the stock take is, where the language and communication pathway is up to in that locality, and then to identify priorities for going forward. And then we take all those priorities and we collate them, and then we see where we can add value from a GM perspective. We use evidence to inform our actions and practice. I will talk more about that later on. And we use local innovation. So whilst there is an overall GM structure, we encourage local solutions to that, to work with the local populations, because localities know their populations best. And we take a flexible approach to responding to the diverse needs, so that we don't have a kind of one size fits all. What we try to do is make sure that we offer a flexible and user-informed approach to early language and communication. So this slide is just to give you an idea of the our language and communication pathway, and the resources, particularly the resources that we have available. And we are, I think, very generous with our resources in that we put them available so that anybody can access them. And we have a multitude of resources on this website. And what's been very interesting for me is actually looking at the analytics behind this, is that this is incredibly well used by people, not only all over Britain, but all over the world. And I had a really interesting email from somebody in New Zealand who was very cross that they couldn't access the BBC Tiny Happy People clips, which are linked to a lot of our top tips, because they were obviously not in the UK. But it clearly shows that there's a really there's a need for good quality resources, and we've been very fortunate, because the BBC actually sits in Salford, that we do a lot of work with them, and we are able to use their resources to support the work that we are developing in GM. So just some key points from our early language and communication pathway. I said at the beginning, this is very much a population approach to language and communication need. So obviously, while practitioners consider the individual children's needs, that's not my role. My role is to actually think in terms of that whole population, what is needed. We look at the demographic data of our localities, and we try to focus our need in the areas of highest need. So it's a data-driven approach to population health. I've already talked about early identification and intervention. It's really, really a multi-agency and partnership working approach, with families central to this process. But we try to really reach out. So we are working with our academic partners, we are working with our partners in the voluntary and independent sectors. We try to make it all encompassing, because everybody has an impact on children's early language and communication. And therefore, it's everybody that we need to be kind of cognizant, if you like, of our philosophy. So our pathway, which is the simple diagram, is supported by an implementation guidance and standards document, which is 55 pages long. It was an absolute nightmare to write, but it is really useful for commissioners and providers because it sets out the standards exactly of what is expected to be commissioned and delivered. And so for example, when a health visiting contract comes up, the commissioners can go to the section on health visiting and lift out the requirements from the GM specification and kind of drop that into their local specifications. So it helps really identify what needs to happen and how it needs to happen and what it needs to look like. The intervention aspect of the pathway is very much focused on that universal and targeted offer. We understand that there's a specialist element to all of that. So we ask our specialist speech and language therapists to be the kind of clinical advisory element through that offer. And we make sure that they are visible and providing that support in a really easily accessible way. You know, it varies. I don't want to make out that this is a perfect agenda because it's really not. It varies across localities, but there is a move to being more accessible, more easily accessible, to make sure that that the universal and targeted offer is really robust and in place, and that then supports practitioners to be able to manage language and communication needs without referring through to a kind of medicalized intervention. I showed you the slide before where all our resources are housed. We have GM top tips for talking, 0 to 5s. We have a different edition for baby version. We have resources for multilingual learners, for supporting dads, and all these have been co-produced with families. So we feel that they are what people are wanting and kind of meet families' needs as well. Underpinning our approach is very much a behavioural insights and research-based approach. So we kind of look at the research, we try to amalgamate things as they come out. So for example, in COVID, I was able to pull together lots of the research data on language and communication needs and put that into a paper to inform localities so that we were able to target our approach after COVID to the children who are likely to be most vulnerable. I mentioned before we do a pathway stock take, which takes place every 2 years, and that's invaluable in kind of shaping our work plan going forward. We also work with the infrastructure that is around us, so we work closely with the Better Practice Hub and we support family hubs. And we do lots of this translating research evidence and delivering it into practice. So for example, we have just completed some work with EEF looking at our welcome training, and we are in the process now of implementing all the recommendations that came from that work. Okay, I'm not really going to focus too much on these slides, but just to say that we are very blessed in Greater Manchester in that we have fabulous data analysts who work in early years, and they are incredibly supportive. So we can actually get to grips with our data. We can get to grips with it at a GM level, but then obviously also by locality level. And that's really, really helpful in planning. That's all I need to say about that. So what this is showing us is that of the domains of the foundation, early years foundation stage, language and communication is the most delayed for our children. And that at one point in Greater Manchester, we were closing the gap between the GM average and the Northwest average. Unfortunately, with COVID, I don't know if people are aware, but Greater Manchester was locked down for longer than most other parts of the country. And the consequence of the language and communication consequences on children were very stark indeed. And so that gap opened and became a kind of gaping chasm of need. So we've worked really, really hard to focus our attention and start to close that gap again. From 21-22, the 22-23 results are better, but there is still a gap, and we are continuing to focus our attentions and support children. But those children obviously are coming through school now, and we are seeing that schools are finding the language and communication levels of many children in our area very difficult to manage, because they are in a position where formal education is starting, but children haven't got those basics of a language and communication level which will enable them to start learning. So we're having to do a lot of remedial catch-up. I'll just pop that in because it actually shows by the different aspects of language and communication. So you can see speaking and speaking is more depressed, if you like, than listening and attention. And the learning from the GM pathway, and I think the learning is that speech, language and communication needs is everybody's business. And actually, if it's framed in a way that makes it everybody's business, it's remarkable actually how people kind of understand that concept. So it requires tenacity and determination to keep talking about it and keep raising it up the agenda, but it's definitely worth it and it definitely pays off. I think leadership at all parts of the system is really important because that enables it to happen. And it's not just, you can't just work on the ground and think, we've got to really do this as practitioners, but actually it has to be recognized at a strategic and planning level at different parts of in different parts of the system. So yeah, that leadership, that strategic leadership is really, really important. And so is setting standards because it gives a level of accountability and it allows people to kind of see what is required and then to meet that requirement with the local flexibility in delivery. And I think that's really very important because our populations in GM are very different. We have some localities that have extremely high levels of language and communication need. Others have moderate levels, but they have other issues in their localities. So it's very important that people who understand their localities and their populations, their demographics, are given the flexibility to address these things, but within that wider framework. I've talked about the process being iterative, and I think that's really important. It's not a static thing, our pathway. We try to incorporate all our learning so that we can make it as effective as possible. And we're learning all the time. And every piece of research that's carried out in Greater Manchester and the consensus of the literature research is incorporated into the pathway. I've talked before about the importance of quality assurance, and I think what we have learned from our pathway is that if you put something in place and then take your eye off the ball, it doesn't continue to happen on its own. I think that quality assurance process and that going back and supporting to bring things back to a level is incredibly important, and it really embeds the process. So yeah, quality assurance to me is absolutely vital. And looking at this whole implementation as a long-term approach, you can't. I've talked before about the importance of quality assurance, and I think what we have learned from our pathway is that if you put something in place and then take your eye off the ball, it doesn't continue to happen on its own. I think that quality assurance process and that going back and supporting to bring things back to a level is incredibly important, and it really embeds the process. So yeah, quality assurance to me is absolutely vital. And looking at this whole implementation as a long-term approach, you can't just implement a pathway and walk away. It has to be maintained, it has to be further developed, and it takes time. Changing children's language and communication takes time, and it takes effort, and it takes a coordinated approach. And what we've realised recently is that we need to pay much more attention to working effectively with families. So it's co-production is one thing, but actually really hearing the voice and the needs of families is something more detailed and more nuanced. And as I mentioned before, working with families who have have a very particular view of their role in child development is our latest challenge, is something that we're kind of really trying to address, because it's about how do we support families to I guess change their thinking, and their thinking is shaped by the environment that they're in, and their own experiences as children and young people. So that sort of community developmental approach, really understanding families, understanding what people's needs are, and working with them to develop a solution is the way forward. And as I mentioned also previously, a 2-year assessment is too late, and we're looking to implement an earlier assessment.